January 7th, 2026. Someone on the International Space Station gets sick. Within 48 hours, NASA is planning something they've never done in 25 years. Not because they want to, because the alternative is watching someone die on camera while Earth-based doctors talk them through procedures that won't work. This is Crew 11. 4 astronauts, 5 months into their mission, orbiting 400 kilometers above the only hospital that matters. One of them develops an undisclosed medical condition serious enough that NASA cancels a scheduled spacewalk and starts planning the first medical evacuation in ISS history. The problem isn't just what's wrong with the astronaut. The problem is that up there, they have no way to find out what's wrong, and the rescue itself might finish what the illness started. The ISS medical kit is designed for minor injuries and stabilization, not diagnosis. You've got blood pressure cuffs, an ultrasound, basic surgery tools, IV drips, no CT scanner, no MRI, no surgical suite capable of handling anesthesia in microgravity where your lungs don't work right because fluids pool in your skull instead of draining like they should. When something goes systemically wrong, cardiac complications from fluid shifts, radiation exposure triggering cellular damage, immune suppression letting infections run wild, your options narrow to 2. Wait and hope the patient stabilizes, or subject a weakened body to 11 hours of ballistic re-entry, ending in 4 Gs of deceleration. NASA's chief medical officer calls treating conditions in microgravity trickier. That's the polite version. The reality is you're performing medicine in an environment actively hostile to human physiology. Blood doesn't flow, it redistributes. Your immune system is compromised. Bone density is draining away at 1% per month. A treatable cardiac issue on Earth becomes a countdown in orbit because your cardiovascular system has already deconditioned after 5 months of weightlessness. You can't even do proper CPR. Astronauts train to brace with their legs against bulkheads because normal chest compressions would just push you away from the patient you're trying to save. Here's what a controlled medical evacuation actually means. They're undocking the Crew Dragon capsule January 14th, splashdown off the California coast January 15th at 3:40 a.m. Pacific. The astronaut, stable but serious enough to warrant cutting the mission 6 weeks early, will endure re-entry forces their body hasn't experienced in 5 months. Muscle atrophy, cardiovascular deconditioning, orthostatic intolerance so severe that standing up after landing can cause blackouts. Now add whatever medical condition is serious enough that NASA won't even disclose it publicly. An untrained person blacks out between 4 and 6 Gs. Dragon re-entry pulls up to 4 Gs in a body already compromised. Complications occur during descent. The patient is strapped into a seat with nowhere to go, no emergency room, no ability to adjust course. Medical teams will be waiting at splashdown. SpaceX recovery ships, NASA flight surgeons, helicopters standing by to rush them to shore and then jet transport back to Johnson Space Center. But that's only if re-entry goes smoothly. If the medical condition destabilizes under G-loading, if the cardiovascular system can't handle the transition back to gravity, if bone fragility leads to fractures during the forces of splashdown, there are no options. You ride it out or you don't. Imagine having a stroke in Antarctica during winter. Now remove the diagnostic equipment. Now add immune suppression, bone loss equivalent to osteoporosis, cosmic radiation exposure measuring 8,100 micrograys from a single solar particle event. That's 30 chest X-rays at once. Now make the ambulance ride home a rocket re-entry pulling forces that can cause loss of consciousness while blood drains from your brain. That's what NASA is calling a controlled medical evacuation. The ISS represents humanity's crowning achievement in continuous orbital habitation. 25 years without a single medical evacuation. Not because astronauts don't get sick, not because microgravity is safe for human bodies. We know it systematically breaks them down. Because until January 7th, 2026, they'd been lucky. Because until now, whatever went wrong could either be stabilized with the medical equivalent of a remote village clinic or wasn't serious enough to justify risking someone's life on emergency re-entry. All 4 Crew 11 members are coming home together because that's how Dragon works. You can't split the crew, can't leave anyone behind. They all rely on the same capsule for life support and emergency escape. So 3 healthy astronauts cut their mission short to bring 1 sick crewmate back to a planet where medicine actually works, where you can run a CT scan, where surgeons have to magnetize their instruments to keep them from floating away, where if your heart stops, compressions don't require bracing against a wall. This will happen again. Next time might be on Mars, where there is no rescue window, where the best-case return trajectory is months, not hours, where controlled medical evacuation isn't even an option, just a long wait to see if the patient survives with whatever supplies you brought and whatever procedures a non-surgeon crewmate can perform while watching instructional videos beamed from Earth with a 20-minute comm delay. Space doesn't care about your preparedness drills. The safest place humans have ever lived beyond Earth is so medically inadequate that a condition treatable in any terrestrial emergency room becomes grounds for gambling that re-entry won't kill the patient faster than the illness. 400 kilometers separates the ISS from definitive medical care. It might as well be 400 light years.